When you are sick, you need a good ambience to pick your medicines. Maogola Pharmacy is here for you. Has human medicines for both retail and wholesale. Found in Sembabule and Chigangazi Town Council. Call us on 0200 908 184 Sembabule or 0700 577 241 Chigangazi. At Maogola Pharmacy, we serve with care. When you are sick, you need a good ambience to pick your medicines. Maogola Pharmacy is here for you. Has human medicines for both retail and wholesale. Found in Sembabule and Chigangazi Town Council. Call us on 0200 908 184 Sembabule or 0700 577 241 Chigangazi. At Maogola Pharmacy, we serve with care.
Welcome to Bikoff Medical Center, located in Masakasi and Sembabule Town Council. We have a dedicated team of health professionals ready to serve with love and care. We offer a wide range of services: a diagnostic laboratory, ultrasound scan, dental services, maternity and surgical services, physiotherapy, For more information, call us on 0759 54 1708 Masaka and 0759 54 1703 Sembabule. Bikoff Medical Center, we treat good health.
Okay. Good evening, colleagues. Good evening, my viewers. Welcome to Ask Dr. UTHUMAN YouTube channel and TikTok channel. This is, I told you, it's a channel where you learn medicine at the comfort of your living room. So what you need to do is to just tune in and then ask any medical question. I told you, I'm interested in fertility questions regarding reproductive health. Some of you really ask me questions. Some of you come in for questions which I am not so much conversant with. When you're asking about child health, you're asking about those general things, malaria and so on. I may not be so much in position to answer you, but if you ask questions concerning fertility, then I will be of help to you. Thank you so much for joining. And as usual, we shall start with the first person to ask. Those of you are new to this channel, please do not forget to subscribe and also press the notification bell in order to be notified of any updates we make. Sorry, I've taken long without doing lives. I've been so busy, very busy. I had a lot of people to work on, so I couldn't manage to have our lives, I think, for the past something like a month. And also those expecting our videos, I've also not been able to record for you videos, but inshallah, in a few weeks to come, I'll be recording videos for you. So let's straight away go to your questions. Please ask questions of your choice, and then we answer. We go with, okay, all of you are still greeting me. Rafina Ebeniche. Rufina Ebeniche. Greeting, Doc. Greetings to you. Where are you watching from? Ebenechi, you're likely to be Nigerian. Please confirm if you're Nigerian. Let us know where you are watching from. Good evening to you. Then we have someone is called, okay, some people are asking in a different language which I may not be able to answer. People asking in Kiswahili. Hi, okay. Someone is saying, good evening, Dr. Water Constance. Good evening to you. John Kasibante, this must be Dr. Kasibante John. Dr. Kasibante John, how are you? Where are you watching from? How is the going? It's been a long time, Dr. Kasibante John. It's been a long time without seeing you. Then Mercy, all of you are still greeting me. Let me look for questions. Okay. Mutu kama akuwa process ya really Kiswahili, no. On our channel we only use English. Greetings, all right. I have a question on fertility. Mase Waithera, a question on fertility. Which question is that? Even if you don't tell me whether you have a question, just post it. Just post the question and then we shall be able to answer. Sorry dear, but we appreciate. All right. Cakes by Anne is saying, Doctor, 3 months now after IUD but no pregnant. Cakes by Anne, where do you make those cakes from? Please tell us where you make those cakes from so that my viewers can come and eat some good cakes there. All right, so you're saying that Doctor, 3 months now after IUD but no pregnant. You should be really a little bit, you should be, what's happening here? TikTok. Okay. So you're saying 3 months after removing an IUD, but you're not getting pregnant. You need to be a little bit patient, okay? Sometimes you can take a little bit longer than the usual time, because actually, for an IUD, when you remove an IUD, as long as it was a non-hormonal IUD, that is the copper T IUD. If it's the copper T IUD, we have an assumption that immediately after removing the IUD, when you reach fertility, when you have sex on your ovulation day, you'll be able to conceive, because an IUD is like a barrier method, and with the barrier methods, the moment the method you stop using the method, you can conceive as soon as immediately. But of course, spending more than 3 months without conceiving, that cannot be a big problem, because you know, even when you're not using any family planning method, even when you're just having live sex every day, you can spend more than 3 months without conceiving. So it may be maybe you're not having sex during your ovulation day, like maybe every time you're having sex, you're in your safe days. Or in other words, you just need to be a little bit patient. We start getting worried when you spend 6 months. If you spend 6 months without conceiving, 6 months without conceiving, and you're not using any family planning method, like you who was using an IUD, then that's when we start worrying, and we can do investigations to find out why. So, but at 3 months, no worries. Okay, okay. Bulenge Medical Services, my OB BSK. All right. How are you, Bulenge Medical Services? Okay. Please help. Please, hepatitis B treatment. Hepatitis B treatment, you know, I've already said that please ask fertility questions. But anyway, something to do with hepatitis B. Hepatitis B is it's a virus which affects the liver, and that's why it's called hepatitis, because the liver cells are called hepatic cells. So when they are inflamed, it becomes hepatitis B. Now, the treatment of hepatitis B, of course, goes to most times we shall give ARVs. There are some ARVs, especially when the combination contains tenofovir and lamivudine. That combination can be given to someone who has hepatitis B. So in other words, a person with hepatitis B is given medicines that are a little bit similar to the ARVs or to those medicines taken by someone who is having HIV. But of course, there are steps, there's a process someone has to go through before you begin those ARVs. There is a process, okay? So there is a process. It's not that when you have hepatitis B, they just start you on those ARVs. There is a process. You have to first we have to first do an assessment. We do an ultrasound scan, liver functional tests, and then we also do the hepatitis B core antigen. When all those ones are assessed, then someone can have those drugs given. There is also a drug called interferon gamma and interferon alpha. Those drugs have also been given to people. The interferons have been given to people with hepatitis B. So, but for much details, you can really go and ask a physician or an internal medicine physician. Okay, so we have more questions here. Nachintu Aisha is saying, Doctor, what happens when the baby is in too much water? All right, when the baby, I think you're talking about a fetus. That is called polyhydramnios. Polyhydramnios is a condition whereby a woman has more than enough amniotic fluid. What do I mean? Usually, when a woman conceives and the baby is transported or is moved from the fallopian tubes to the uterus, the baby is embedded into the amniotic fluid, because there is what they call the amniotic sac, which contains the amniotic fluid where the baby is supposed to be. Oh, how should I explain this? Someone get me a Kavera. Okay. In other words, assume this is the uterus, okay? Assume this is the uterus. When the baby is there like this, the baby is surrounded by fluids, and those fluids are called amniotic fluids, okay? So there are different pouches of amniotic fluids, okay? There are different pouches. Now, but there are those required volumes. If the volumes are high, if the baby is embedded into too much amniotic fluids, we call it polyhydramnios. Now, that condition, once it happens, it means the woman has to be monitored. The woman has to be monitored, and if it is severe, then delivery can be planned. So when they tell you that you have too much water in the uterus or polyhydramnios, then it has to be quantified. There is mild polyhydramnios, there is moderate, and there is severe polyhydramnios. So now, depending on that, then management can be set. But also, when someone has polyhydramnios, it's like when you're having oligohydramnios. Oligohydramnios is when there is little fluids in the uterus, or there is little amniotic fluid which is covering or which is bathing the fetus. There can be like a likelihood of infection. So sometimes you'll find that the doctors will cover that person with antibiotics, depending on the assessment which has been made, but also depending on the severity of the polyhydramnios or the oligohydramnios. Christ Ellen is saying, Doctor, how are you, doctor? What if my woman is keep on having miscarriage? What can I do? If you keep on having a miscarriage, we call that recurrent miscarriages. I talked about recurrent miscarriages here. I think check on one of my YouTube videos. There is a video where I'm talking about causes of recurrent miscarriages and how you can manage them. But one of the major causes of recurrent miscarriages, it's the rhesus factor incompatibility. You find that the woman's blood and the man's blood are not compatible. When a woman has blood group A, maybe A+, and the man has B negative, then there is what we call blood group incompatibility, especially the rhesus factor. So when there is rhesus factor incompatibility, I told you that usually the firstborn gets fine and you'll give birth to a live bouncing baby, the firstborn. But the secondborn, you'll have, in most cases, you'll have miscarriages or early neonatal death. So that blood group rhesus factor incompatibility is one of the causes of the major causes of recurrent miscarriages. There is also people with chromosomal abnormalities. If either the sperm or the ova has a problem, that is called a chromosomal abnormality. And when you have chromosomal abnormality, of course, that can also cause
when
miscarriages.
You are sick.
Then another item that can cause miscarriages, of course, there are those infections and so on. But when we are talking about recurrent miscarriages, we can mean that there is also what they call incompetent cervix. Women with incompetent cervixes. What do we mean by incompetent cervix? It's like a cervix that is short. You find a short cervix and it is thin. When that cervix is thin and short, it will be incapable of keeping the baby, and therefore you end up having miscarriages. Another cause of miscarriages is hormonal imbalance, especially women with low levels of progesterone. If a woman has low levels of progesterone, then they are prone to having recurrent miscarriages. Okay, then we have the cause mwenda. I am having challenges with booking an appointment. It keeps saying service is under maintenance. I have been trying for days. Oh, do we have a problem with our website? Try our website to find our way, try something. If appointments cannot be made, then try making an appointment. All right, we are going to rectify this. The man behind our camera, casebackit.next. Please go to his YouTube channel, and those challenges will be solved. He's going to check and find out whether we have a problem with our website. We didn't know that. Then if it causes mwenda, what causes right pelvic pain towards periods after a miscarriage? It is first of all, pain towards periods sometimes is normal, by the way. But though if you say after miscarriage, then maybe you have you may be having maybe some retained products, or there are still some other stuffs that remained in the uterus, or you are maybe having a PID, that is a pelvic inflammatory disease, or maybe you have an ovarian cyst. So what you're supposed to do is to carry out tests, okay?